which are foreign bodies. We call them antigens, and that could be exposure to dust, dirt, foreign particles, pollution. If your immune system is depressed, decreased, you have, again, an increased risk of developing an inflammation in the lung tissue, having, again, a hypersensitivity reaction, and developing edematous or swollen tissue in the lungs, and having obstruction, which leads to an asthma attack.
Right. So coming into a medical center like All Med and saying, I want to have my immune system checked to see, just can that be done?
We can do that, but usually you go to an allergist
Yeah.
or an immunologist. A lot of times allergists are double-boarded in immunology, and they would do specific tests for that. But I would do a basic screening test, like a CBC, to make sure there's no inflammation or increased cell counts with your white blood cells or within your immune system, because it gets broken down in certain cell types, and I would look for that as well.
Okay, very good. Now, let's talk about treatment, because as we speak, there are many people that are watching this program, and they have asthma, and or they certainly have a good understanding of it, that this breathing problem that they're having and the shortness of breath may very well be asthma, but now they need to be treated. Just talk about treatment.
Right. Well, before we get into treatment, again, you know, I like to emphasize the importance of, one, education, two, a thorough history and physical, and then a routine lab work. Once I have a clinical diagnosis of asthma, I can do the certain tests like a peak flow meter or spirometer, what we call pulmonary function test, to see where their baseline is.
Right.
The baseline will give me an indication of how controlled or how advanced the asthma is. And then what I would do is I would cater the treatment based on the needs of the patient. We have different categories of medications, and I would determine which category of medication to give and what the baseline is. Before I go into different types of medications, I'm not going to get specific with the medication. However, I like to emphasize that the gold treatment or gold standard for treating asthma at this time is corticosteroids.
Right.
Since I mentioned corticosteroids, I'll use that as a category to start. Corticosteroids are medications that reduce inflammation.
Right.
That is their primary function. They reduce swelling. They could be inhaled from a pump. They could be given from injection. They can be given in a pill form. They can also be given as a liquid form and IV. So if there was an emergency and you were in a hospital and we had to push medicine, we could push a corticosteroid.
Right.
And that will speed up the process to help reduce the inflammation in the lungs.
And I guess that would open the airways.
Well, indirectly it will be. Yeah, it will, because it reduces the inflammation. Remember, we had that cascade of the hypersensitivity, the inflammation, and then the obstruction. Well, we need to reduce that obstruction, and in order to reduce the obstruction, we have to reduce the inflammation.
Okay, we're going to go to a tool that's used to do that, and you can tell us just how that works. And I think that's going to be very helpful to the people. You can go right ahead.
Okay. Well, one of the tools that we have to treat in the office and home, because I prescribe this home for our patients, is what we call a nebulizer machine. And this is a machine that takes oxygen and speeds it up and compresses it, and we have the medicine that's in liquid form, and it becomes a mist, and you breathe this mist in, and this helps open up this particular medication, which would be a beta agonist, will help open up the lungs. Again,
so can that person use this piece of tool, equipment, at home?
Yes.
Right.
Yes. You should, if you're a chronic asthmatic, you should have that prescribed to you by your physician.
Okay.
Yeah, I would ask the physician, inquire about it, and see if they'll write a prescription for a nebulizer machine.
Right. Now, if they came to the hospital and they Is this the kind of equipment tool that would be used for them in an emergency case?
That's correct. Yes.
This would be this would be used.
Yes, it is.
All right, and then of course prescribe that they get this instrument, this tool at home as well.
The hospital might not prescribe that for you because
Yeah.
they would probably refer you back to your primary care physician, and then your primary care physician for follow-up, then they would prescribe that.
So in an emergency case, the best thing for the person is to go into the hospital, but then go back to their primary care to get the follow-up or to move them forward. Okay.
Well, that would be one way to do it. Another way would be is if there's an emergency, and if you can get into your primary care physician first, if your primary care physician's available, and then we could treat it in the office. Now, it all depends on the severity of the asthma attack. If it is very severe, I might have to send you to the hospital and have you worked up and possibly admitted for the IV medications to help reduce that inflammation if it's extremely severe. If it's mild to moderate, I usually can treat it in the office and then send them home on medications. If it's moderate to severe, depending on the compliance of the patient, if I feel the patient is compliant, will follow my instructions, I can usually send them home on medications and give them instructions what to do. If I question their compliance, then I will send them over to the ER. If it's severe, I'm sending them to the ER. I'm not going to fool around because this is a life-threatening disease. Right,
and you will be careful in making that kind of decision.
That's correct.
Okay, we're going to now go to our next Ask Dr. Tommy O's program, and our next medical program will be in March. And we're going to now look at not what we're going to be dealing with in March, and as well as April and throughout the rest of the year. So, folks, we want you to just take a look at the chart, and Dr. Tommy O is going to now, right today, this is now February, we have dealt with asthma. And our program calendar tells us that in March we'll be dealing with lower back pain. I want you quickly just to give people just a little insight on it. And of course, in April, we'll be dealing with HIV/AIDS, and we're going to have a great gospel concert, which will include screening for not only HIV/AIDS, but we'll be giving a lot of information and screening for hypertension and diabetes. It's going to be a great time at Church Alive to hear some wonderful gospel music, but at the same time, they're going to get some free screening. Okay, but tell us about March, and then we're going to move on.
Okay. Well, we have some exciting topics. In March, we're going to cover low back pain. Low back pain is pretty significant in our community and in America in itself. Low back pain is within the working class is the #1 cause for disability.
Okay. Dr. Tommy O, you'll be coming to Church Alive also in the month of March, March 3rd. And we're going to be dealing with the spiritual healing and how it works hand in hand with modern medicine. And I wish we had time to go into that now, but it sounds exciting. And of course, we're at Church Alive. We're all excited about this program, and our community has been really enriched by the information that you've been bringing to them from month to month. But we want all of you, and we want to look for our folks. So I want you to just give us a closing statement. We just got about a minute to tell us quickly about what's going to happen at Church Alive March 3rd, and when that seminar you will conduct. We got only 30 seconds, but we'd like to just share with them spiritual healing and how it works with modern medicine.
Right.
Ed.
Well, the topic I chose was spiritual healing and modern medicine, how they work hand in hand. It's very important because part of healing is the continuity of working as a team. You have the mind, the body, and the spirit. And this is something that I cover and I address with my parents. Oh, my parents, but with my patients as well.
Okay.
It's very important because we're a whole person, so you have to treat the whole person.
Thank you very much, Dr. Tommy O.
Thank you.
Okay, that falls right in line with Church Alive, folk, and because we believe at Church Alive that God is not only concerned about the spiritual needs of mankind, but he's also concerned about the physical needs. So we take a holistic approach to the gospel, and that's what it's all about. And that's why we have brought information, resources, and service to you that we know will improve your lifestyle and improve your health as well. And also